My dad had a big impact on me growing up and ultimately how I practiced dentistry. I remember watching him interact with his patients in town. I remember watching him go to the grocery store with him and having his patients look at him and the gratitude they saw and how they respected him. I graduated dental school in 1998 from the University of Mississippi Medical Center School of Dentistry and immediately moved to Arizona and worked with a dental anesthesiologist focusing on kids. A lot of people ask me how I had the vision to create a big practice with as many practices as we do. But the reality of it is I didn't have a plan to create something like this. You know, I borrowed $20,000 on my credit card to open this first office. And I went in there and my thought was, this might not work. I might go bankrupt. We went in there to do the best office we could in a lower income area. We were going to treat the patients in West Phoenix like they were in Scottsdale, Arizona. And the feedback we got was enormous. Our practice took off. After about 4 months, I had 3 doctors working in that one facility. And it was truly not only taking care of patients, but trying to figure out how to manage this quick growth. After we were open for a short amount of time, the insurance companies came to us about opening offices in other parts of Arizona. We ended up opening in Sierra Vista, and we got busy right away. And then we were driving between here and Sierra Vista to do dentistry going through Tucson, so we ended up opening in Tucson as well. The next thing you know, about 3 years later, we had 7 offices in the state of Arizona and then started looking to expand in other states. We're in Arizona, Texas, Mississippi, and North Carolina. We have a little over 70 providers and around 700 employees. We also now do orthodontic services in some of our practices as well. Most of our offices are in rural areas, and I think, you know, we get a lot of gratitude when we go into an area that's underserved. Patients love the service that we're offering, and we're able to get providers to go to those areas. Their kids go to school there. They coach sports with their kids. So we have, not only do we have a local feel, we have a permanent local presence in the communities we're in. A lot of dentists come out of dental school, they don't have any experience in billing or accounts receivable, so we decided to start KDB to centralize functions. That way we're able to do marketing, accounting, accounts payable, accounts receivable, and we're able to take those responsibilities out of the office so our dentist and our team can focus on patient care. My approach in treating kids has always been simple. We put patient care first. Whatever the patient's needs are, whatever the kids' needs are, that's what we're doing. We train our doctors, you know, we train them, they come out of dental school. Most dentists don't get a lot of experience treating kids in dental school, and we get a lot of new grads that join our group. What we've done is, with that variation, is we bring our doctors in here and we train them in a sim lab. So we take the noise of the clinic out of the equation, and you're able to focus on the core purpose and the core values that we try to instill in our doctors. It just makes our doctors more comfortable when they go into an operatory treating a kid because they know what they're doing. They have the skills to go in there and execute on what needs to be done. We're dialing in a mentor program now. Not only do we train them here on site and we put them back in the office, but once they get back in the office, they have someone they can call with questions and someone to work with to continue to grow as a professional. I think one thing that sets us apart from a lot of other groups is we have a path to true ownership. It's pretty simple. You prove yourself as a clinician, you prove yourself as a managing dentist, and then you become a true equity partner. The managing dentist can happen as short as 9 months, and the equity ownership can happen as short as 1.5 to 2 years. The reason our tenure is so much longer is we have that path to ownership, and that's what draws people to us to stick around in the long term. Our core values are compassionate, authentic, talented team players, and we shorten that with C.A.T. But it's a must. You have to have 3 of those 4 and working on the 4th. We hire according to these, we promote according to these, we terminate according to these. These are the things that we found are vitally important to being able to treat kids and do a good job of doing it. What wakes me up in the morning, what I get excited about, is continuing to create opportunities for all of our team members, for our assistants that want to travel and help us open new offices, for our front office people that want to grow into regional managers, for our associate dentists that want to grow and become a partner in our group. But it all comes back to doing what's right for the kids and giving them the ability to get the gratitude that I got when I first started treating patients.